The Federation of St. Kitts and Nevis has been kept in a safe bubble, different to the Caribbean bubble to which the Prime Minister referred for some time. Over the last 7 months, while the rest of the world struggled to contain the deadly coronavirus, we were able to successfully emerge from the lockdowns and restrictions imposed earlier to a near normalcy internally. We saw churches, schools, and businesses open, and our people began to move around freely within the new norms. We safely repatriated many nationals, residents, and students from hotspots around the world without seeing a resurgence of the virus locally. The 19 imported cases we had have all recovered, and we are now one of the few nations around the globe with 0 active cases. We used a prescription of non-pharmaceutical measures, i.e. physical distancing, hand sanitizing, and wearing of masks, along with our robust testing, isolation, and quarantine measures to contain the virus. Our singular focus was lives over livelihood initially, and we saw great success in the fight against the virus compared to many great nations. As we emerged from the harsh restrictions in an effort to generate economic activity and get back to near normal, some began to experience COVID fatigue. People got tired of being cooped up, tired of being careful, tired of being scared, tired of wearing masks and social distancing, and wanted to get back to their normal life. It is this fatigue that made some people become careless and complacent, which is contributing to some of the spike in cases we are seeing around the world. I am happy, however, that with our all-of-society approach, we were able to get the majority of our people on board with a laser-eye focus on fighting this virus. The virus has not left us. As we see globally, there are over 46 million cases and over 1 million deaths to date. Just to the north of us, the United States is experiencing a resurgence of cases with about 9.2 million positive cases and over 231,000 deaths. Since the last October 29th CARPHA situation report, an additional 7,019 cases were confirmed in 27 countries within the Caribbean, bringing the region's total confirmed cases to 277,170. This total represents a 3% increase in the number of confirmed cases, which is significant, and a total of 4,564 deaths as of November 2nd. A number of countries within the bubble that the Prime Minister referred to are experiencing an increase in their cases with possible community spread. These are Barbados, Antigua, Dominica, St. Lucia, and St. Vincent and the Grenadines. The CARPHA agreement clearly recommended that countries should have no new cases or less than 20 cases per 100,000 in the last 14 days to be eligible to be in the bubble. It also gave member states the flexibility to reintroduce travel restrictions for a specific country if the criteria are no longer met. The agreement also gave member states the flexibility to refuse entry to the non-national traveler presenting a threat to public health or national security, even coming from a country from which the restrictions are lifted. Once we continue to have different entry requirements across CARICOM countries, we will have different levels of risk and exposure to the virus. Our low-risk status that we currently hold will be jeopardized by any country with a less stringent protocol for entry than we do. The negative PCR test prior to arrival and a 14-day quarantine and vacation in place is what has kept us safe thus far and made us a preferred destination on the tourism map. Once we keep the health and safety of the nation as our primary focus, then every decision thereafter is made much easier. That is why, after re-evaluating the situation with regards to the increased spread of the virus in some of the countries in the regional Caribbean bubble, we came to the decision, in the best interest of the nation, to exit the bubble. All visitors to the Federation will therefore be considered high risk and subject to the same protocols for entry. We will continue to work with our CARICOM neighbors to develop protocols uniform to all so that we will all have the same level of protection of our borders from the virus and eventually move freely in a common space. Until such time, the task force is in full support of our removal from the regional Caribbean bubble. Lastly, as our borders are open now, we need to remember the essentials in fighting COVID-19. First, we need to prevent amplifying events by avoiding the 3 C's: crowds, closed spaces, and close contact. Second, we need to protect the vulnerable among us, the elderly and those with pre-existing conditions. Third, we need to continue to educate, empower, and enable communities to protect themselves and others using every tool at their disposal. And fourth, we need to continue to get the basics right, as we have done, to find, isolate, test, and care for cases, and trace and quarantine their contacts. Remember, until a vaccine becomes available, an essential tool in the fight against the virus is the face mask. Please wear it. I thank you.